Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Paving the Path to Wellness series, a special collaboration between the Blum Center and the Paving the Path to Wellness program within Lifestyle Medicine at Cancer Center, Mass General. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it will be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has mutes. You can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you was complete. Your feedback is important to us as we plan future programs. All right, so joining us today, we have Lauren Winters. Lauren is an oncology nurse practitioner with the Breast Cancer Treatment Program and Lifestyle Medicine Program at Mass General Cancer Center. We also have Dr. Sylvia Perry. Sylvia is a nurse practitioner with Mass General Surgical Oncology for the breast, as well as the Paving the Path to Wellness program. We are also joined by our very special guests, Dorothee and Terry, who are PAVING graduates. And they are here today to lead our session on exercise as medicine, why physical activity matters for cancer survivors. All right, so next I'm going to turn it over to Sylvia, who will get us started.
Thank you so much, and welcome everyone. I'm going to share my screen. Can everyone see that?
Sylvia, it is like the screen with the sort of icons and stuff, not just the slide.
How's that?
Want to try? Yes, that's good.
Better? Okay.
Yes.
Great. All right. Welcome, everyone. It's so exciting to be together and talk about a topic that is near and dear to my heart. Exercise as medicine, why physical activity matters for cancer survivors and thrivers, I should say. So we have some things we will cover today, and we hope that if you have questions, you'll put them into the chat and we can talk about anything more specific when we have time for questions and answers at the end. But we will talk about some of the common challenges of cancer survivors and thrivers as they might relate to exercise and energy, the benefits of exercise, types of exercise and guidelines for exercise, safety considerations, practical tips to get moving and be more physically active. And then we are so blessed to have two PAVING graduates who will share their experience in how they've used physical activity in their healing journey. So if we think about cancer in general, just to give us some perspective, in 2025, about 2 million people will be diagnosed with cancer in the US. The most common types among women are breast, lung, colorectal, and melanoma. And for men, prostate, lung, colorectal, and melanoma. And approximately 42% of cancer cases and 45% of cancer deaths can be linked to lifestyle-related factors. Nearly half of the most common cancers could be prevented through modifiable risk factors. So we think about physical activity and exercise as something that we can manage, we can modify, we can ramp up. And so that's the perspective of where we come to this conversation. Regular physical activity can reduce the risk of several types of cancer, breast, especially postmenopausal breast cancer, colon and endometrial, some of the GI cancers, bladder, ovarian, kidney, prostate, lung, and pancreatic. So we know that being physically active, and we'll get into sort of the why, what's happening in the body, but we know that being physically active can really be beneficial for our health. The general take home is to move more and sit less. We think about physical activity as something everyone has to do. You have to get from point A to point B to get through your day. Sometimes people will have work that keeps them physically active, or they have children that they're moving around with. Some people are active exercisers already and very physically active, and some people are more sedentary. So if we think about exercise on a spectrum from people who are sort of elite athletes exercising at the highest level to the other side, sedentary people who really are not physically active at all, there's a big range in the middle, and we really want to emphasize the importance and the benefit of simply being more active, being up on your feet. How does exercise work against cancer? This is a busy slide, and I will try my best to share some of what is here. But basically, when you exercise, your body releases hormones and other sort of molecules that can have beneficial effects. So cytokines are signaling molecules that are released by muscle cells in response to exercise and muscle contraction. So you can see the rat running on the wheel, and there's the muscle, and in that activity, these myokine substances are released. So these potent molecules can act as a form of communication between muscles and other organs, influencing liver, brain, adipose or fatty tissue, and the pancreas to improve metabolism, insulin sensitivity, and overall health. Regular exercise activates the release of myokines, which act as the body's built-in, quote, medicine cabinet to lower the risk of conditions like type 2 diabetes, certain cancers, heart disease, and some mental health disorders. So these are great molecules that we have, but you need to move to get them to release. They also can be impactful in that they can decrease the expression of oncogenes or some of the genetic activity that can predispose cells turning into cancer. So there is a very biologic basis for the benefits of exercise. And this picture kind of gets to that. This is another slide that we love in paving. Your brain loves the gym or walking outdoors or biking or being on the trail or swimming. These are some of it, again, the things that are released when you exercise. So norepinephrine is released, which can improve your attention, your perception, motivation. Brain-derived neurotrophic factor, BDNF, is released, which is a protective substance, one of these myokines. And can be reparative as well. Endorphins are released. So we think about when you exercise, you might think, I know what it feels like for my heart rate to be elevated or feel a little bit out of breath when I exercise. But on a very basic and more subtle level, you have these hormones, neurohormones, serotonin is another one, dopamine, that are being released by exercise. So it doesn't matter whether you're cleaning the house, gardening, walking, hiking, doing an intense workout at the gym, swimming, all of these kinds of physical activity are helpful for our overall health and for our brain. Some of the challenges. So we assume on this call there are people who have gone through or maybe currently going through cancer journeys or caregiving for family members or friends. And it can be very hard to think about exercise when you're not feeling well. So some of the side effects of both a cancer and a treatment could be fatigue, low energy, feeling like you're not motivated to do things that you might usually do, muscle weakness, loss of stamina. You may take a break. You have to take a break because you've had a surgery, for example. You have to kind of think about building back up, and it's hard to get your mind around that when you may not be feeling well. Psychological effects of cancer, feeling perhaps anxious or depressed, having a fear of recurrence or a fear of doing something that will be harmful. And then there's some long-term side effects that some cancer patients can have, which can include pain, neuropathy, chronic fatigue, or lymphedema. So the benefits of physical activity in cancer survivors may help reduce the risk of recurrence, number one, recurrence of the same cancer that you may have gone through, and lower the risk of other cancers and chronic diseases or cardiovascular disease. Regular physical activity can also reduce the risk of dying from certain types of cancer, and it can impact positively cancer survivors and thrivers in so many other ways. And we'll talk about some of those ways. We talked about what's happening in the brain, what's happening with our myokines, and there are other things that we can gain from physical activity that may have to do with how we're exercising and with whom we're getting exercise. This is another way to think about physical activity benefits. So there's that reducing risk that I just mentioned, preventing chronic diseases, can improve our survival, decreases our mortality rates. And then the enhancing quality of life is something that we love to think about and focus on in paving the path to wellness. So exercise, physical activity can improve our fitness and our stamina and our strength. It can improve our confidence. You're coming out of a really difficult journey when you may not have been feeling well, and you start exercising slowly, steady, building up, and that can really improve mood and confidence and overall well-being. It can improve sleep. Getting regular physical activity is very good for our sleep cycle. It can improve our weight and our fat to muscle body composition. It can improve strength. It can reduce some of those treatment side effects that are very common, things like neuropathy, things like fatigue. Being physically active can have a positive effect on our self-esteem, just like mentioned, confidence, sexual health also. And then it can help maintain for long after our function and strength and conditioning, both during and after treatment. In paving, we focus on several aspects of lifestyle medicine that include nutrition, staying active, maintaining a healthy weight. So we think about exercise and physical activity in the context. There's an intersectionality of physical activity with many other lifestyle medicine concepts, nutrition, stress management, they're all interlinked. When we think about exercise, there are different types. So you can think about something like running or getting on an exercise bike or swimming, where there's aerobic exercise. You get some shortness of breath, you're feeling like your heart rate is up, and you're improving the capacity of heart, cardiovascular, lungs, your circulation. So that's cardiovascular exercise. Muscle strengthening, strength training can be done both with weights, or in this picture, the person in the middle is using resistance bands. And this is a weight-bearing exercise type that is very important for building our muscles and building back our muscles. Again, if you've gone through a cancer journey, you may have gotten deconditioned. You may have been out of commission for a while. So that building back is important in the strength training part of exercise. And then balance. So any type of yoga or Pilates or other kinds of Tai Chi, other kinds of exercise where you're really working on some of your balance muscles can also improve general function and stability, prevent falls. There's a meditative aspect of balance and stretching exercise. So we think of exercise kind of in these three different buckets. In terms of intensity, what does it mean when we say you should get some exercise? What does that actually look like? Light exercise is exercise where a MET is a metabolic equivalent. That's in this slide, that's our measurement. So light exercise is less than 3 METs. It's easy to talk and carry on a conversation. This might be walking slowly, doing some light household chores, and sometimes depending on where you are in your cancer journey, this may be all you can do, light exercise, but this may be more than you could have done last week or 2 weeks ago. So really starting slow and advancing. Fishing, I love that, is in the light physical activity category. Sitting is in fact being sedentary, but you're having to sit up and you're working, you're moving your arms. So that's also in the light category. Moderate physical activity, you're able to talk and hold short conversations, but when you're walking more briskly. You might not be able to carry a tune. You might have to keep, taking some breaths to catch your breath. So this is moderate physical activity, 3 to 6 METs. Moderate household chores where you're moving more, you're washing windows, you're vacuuming, you're mowing, you're doing things that are more active. Riding a bike, doing some sports that aren't super intense, but are kind of getting you moving, badminton, tennis, pickleball, I imagine. And then vigorous physical activity is greater than 6 METs. So it's hard to sort of have a conversation if you're jogging, sometimes if you're hiking and doing kind of a steep climb, shoveling, climbing stairs. Sometimes this feels more vigorous and you really have to focus on that, but you're really burning a lot of energy, you're kicking up your metabolism. And again, think about those myokines and the neurohormones that are being released. Though that's happening a lot in this vigorous exercise. Cycling, this is more fast cycling or extended bike ride. And then the sports would be more sort of intense sports, basketball, soccer, tennis. So if we think about exercise as a prescription, as we might think about, in our PAVING series, we talk about nutrition, we talk about stress management, we talk about exercise, and we can actually have a prescriptive approach to it. What does it actually mean? What does it mean for me? What would I want to do? So we say moderate intense aerobic activity. So that's I would say the middle or more intense type of exercise, 150 minutes per week. So walking, biking, swimming, being outdoors, being active for 150 minutes. So that could be 30 minutes, 5 days a week, or less days a week for longer. And the component that's very important is the strength training. So ideally, if you can add a couple days a week of physical activity that makes you stronger. So this can be resistance band work. It can be doing some lightweight lifting. Some of the exercise modalities like Pilates, where you're doing a plank. There's certain types of exercise where you're doing more weight bearing. That's strength training. So 150 minutes per week of moderate intensity aerobic activity and muscle strength or strength training 2 days a week. Another way to think about an exercise prescription, if we think about side effects of cancer and cancer treatment, is that it can be used for different things. You might be having a hard time with energy or cancer-related fatigue. So we could think about building up your cardiovascular exercise to try to improve that fatigue. And really, again, starting slow and building up. So you kind of get your conditioning built slowly over time. It can be used to improve physical function. So strengthening, balance, just being able to move more easily. Exercise can be helpful for anxiety, some of the fear of cancer, of recurrence, fear around medications that you may be taking or side effects. Exercise, some of those, again, neurohormones can be released and kind of help bring down anxiety. General health related quality of life and symptoms. The slide exhibits the same as the previous, but again, just thinking about exercise as prescriptive for different things related to the cancer treatment journey. Before starting any exercise program, it's important to talk with your healthcare provider. If you're very soon after surgery, for example, you might need to sort of double check on when it is safe to start exercising. If you're beyond surgery or you're taking medications, important to really talk with your provider about what's safe and how you can start to build up. Supervision for exercise may be advised. If you're having any balance issues, working with a trainer, a physical trainer, or a physical therapist can be helpful, where you're sort of getting some support and guidance around exercise and working towards that level of confidence where you can do exercise on your own, but in the beginning parts, having some supervision. And in most cases, there's no assessment required to start low intensity aerobic activity. So walking, riding a bike slowly. We always recommend warming up first, starting low and going slow and cooling down. And if you're doing something, for example, like riding a bike, it's always good to do some stretching afterwards, because if you work your muscles, sometimes they can get tight. So some practical tips to get moving. Starting small, setting realistic goals. If you're feeling exhausted and just sort of coming out of a very intense time of treatment, setting goals that you can achieve. I'm going to go for a walk for 15 minutes 2 or 3 times a week. That doesn't seem like a lot, but it might feel like a lot depending on where you are. And setting goals that you can achieve, not feeling, overwhelmed or looking over at someone else who seems to be exercising more easily. Set your own goals and work on those. Building movement into your daily routines. And that can be if you are back at work and you feel like you're getting back into a sedentary lifestyle, get up and take breaks, move around the office, take the stairs to go to the cafeteria or to go to the parking lot. Build exercise and physical activity into your day-to-day routine. Find activities that you enjoy. I love that joy is in the word enjoy, because exercise and physical activity can make you focus on what brings you joy. Do you love being outside? Do you love hiking? Do you love swimming? What might be something that sort of adds that element of well-being that can be joyful and lift your mood? Scheduling it, moving together. So this is one aspect of exercise that I think is the most important, which is that you can, and we'll learn about this with our guests, you can find a community of people that you're being physically active with, and that can become a wonderful way to be in community and move together and share experience with people who've gone through things that you might have gone through. Mixing it up, having variety, listening to your body. If you overdo it, you'll know, your body will tell you. You can do something a little less intense the next day or take a day off and then start kind of where your body says it's okay. And celebrating small wins, depending on where one might be in their treatment. Certain things may feel like big hurdles and certain things may feel doable, but celebrate any of those, any and all. So we will have a great opportunity to hear about Live Strong, which is one of the programs, which is a lovely social community way of being physically active for patients who've gone through cancer treatment. Here are some others that are get people outdoors. Dragon boat racing is, as it looks in the picture, it's a long canoe and paddling, and there's a whole dragon racing community. And in most areas, if you Google dragon boat racing, if you're in the Boston area where we are at MGH, you'll find a community of people who do this. So if being out on the water is something you're curious about, you may find this community that you're drawn to. First Ascents is an organization that gets people who've gone through cancer treatment outdoors, out hiking, out cycling, doing things that are outdoors. Live Strong we'll hear about. And then sometimes if working with a physical therapist or an occupational therapist is more your speed, that's a good place to start. So you can, from your medical oncologist or your surgical oncologist, or nurse practitioner, you can get a prescription for physical or occupational therapy, which can be a way to get moving and know what you can and should be doing to regain your strength in a more of a prescriptive way. And then physiatry is a whole field of medicine. Physiatrists are physicians who focus on kind of whole body health and quality of life and strength and musculoskeletal health. And they are a wonderful resource, and we have a great team of physiatrists at MGH. So in summary, exercise is safe and effective for cancer survivors and thrivers. We hope that finding something that you love will be a way that you can get started with an exercise program or physical activity program. Start with small and sustainable steps. And then if you think about medicine as movement as medicine, think about all that stuff that's happening in the brain and happening at the cellular, muscular level. That is something that is very good for the body. Live Strong at the YMCA is an option, and we're going to hear about it soon. So I'm not going to talk about this, but this is a wonderful program with support and social connection and community. That's a way to start getting active again if you've been sort of out of a regular routine of physical activity. So with that, I'm going to stop sharing and turn it over to Lauren and our panelists.
Thanks so much, Sylvia. And I just thought there was one question in the chat that I thought was relevant to your talk, and maybe it's worth just taking a moment before we dive in with our panelists. But the question was having to do with if one is a cancer thriver versus perhaps someone with an early stage diagnosis. Is there a different recommendation for the number of minutes per week to aim for? 30 minutes a day? Is it something different for folks who are dealing with the thriving status versus the early stage status? And I know the answer, but I don't know if you wanted to say.
It's a great question. So I think the question is, can you do more than 150 minutes?
Yeah.
Yeah. So the answer is yes. I mean, I've had, we teach PAVING, we teach these groups to breast cancer patients, and I think I've led 4 or 5 cohorts so far. And there's always a range of people who start out as elite athletes, and then they get a diagnosis and they're kind of flattened and trying to get back to their baseline, which is a lot higher than someone else's baseline. So if you're trying to get back to something that's more intense, I've had cyclists who are wanting to go out and do 30, 40, 50-mile rides. It's okay to aim for more than 150 minutes per week. That is kind of the minimum. So if I don't know if I'm answering the question correctly, but yes, 150 minutes of cardiovascular exercise with the 2 strength training days is kind of where we start. But you can, if your baseline is higher than that, you can absolutely do more. And just checking with your provider, depending on where you are, if you've had a surgery, that's always kind of the first place to start with what you can and cannot do.
Thank you so much. That was so great. And there was one other question that I think also is just a quick answer, and it had to do with how does one become a patient of a physiatrist? And I'll just answer that quickly. If there are rehabilitation needs following cancer treatment, then the primary team of the oncology physician or a nurse practitioner can make a referral to the cancer rehabilitation program for the Mass General. So it's just a referral, pretty easy to become a patient. So for now, it would be fantastic. We'll be introducing our 2 panelists. And I'll be leading a discussion with the 2 of them to talk about their experience with exercise. And if it's okay with you both, I'm going to be starting with Dorothee. And so, Dorothee, welcome. Thank you so much for being here and for being willing to share your experience as a survivor, and also, and most importantly, about exercise and the Livestrong program, which I know a lot of folks are really excited to hear about. So I'm going to start you with this one, though, if that's okay. Talking about why exercise matters to you. So can you share what motivated you to begin or continue, if you were exercising throughout treatment, exercising after your cancer treatment ended, and why you feel exercise matters?
Well, first of all, thank you for having me. What motivated me? So actually, the PAVING program had a big impact on me. Just hearing those numbers, how much it actually impacts your health journey and helps you to stay healthy was a huge motivator. It kind of blew my mind to hear those numbers, and that you really you actually can create your own medicine. That is so self-empowering. I mean, you've gone through all this treatment, you got your chemo and your radiation, and now you can do it kind of yourself. That is so awesome. Another aspect is the community. I loved meeting all the women in the PAVING program and or all the participants. And that's also something really, really strong in the Livestrong program, just to see people who are going through this, who are being brave or not, or facing challenges, and you see the tears and you see how they move through it, and that is so helpful, not to feel alone, but you can just jump on the bandwagon and move along.
The power of a community. Can you tell us a little bit about, Dorothee, about how you learned about the Livestrong program and your current involvement? And maybe also tell folks out there how they can access it.
So I actually jumped on the bandwagon all the way because I thought, I want to learn about exercise. So I actually became a personal trainer at the YMCA. So, and now I learned about the program through the YMCA, of course, because I'm working there, and I couldn't join because I was working at the front desk at first, and I was like, God, really, these people come out laughing. I want to join. You know, you see them coming in the first time and they're like very serious and I don't know what they're going, can I do this? And there's a group that forms and they become workout buddies and a lot of bonds keep for a long time. You can even join a group after that that continues the program. So it's not like 12 weeks and then it's over. And then I could join myself. I had just gone through another surgery. I was feeling weak. I was like, I'm a personal trainer, but I don't know how to get myself up again, you know?
Yeah.
I didn't feel confident. I was scared. And that just helped me a lot to train with people who actually know what they're doing, who can really shape the program in a way that you need. And I couldn't even do the assessment test in the beginning because after the surgery I couldn't go full force, and that was okay, no problem.
Yeah. So what I'm hearing you say in terms of the program structure, first of all, for folks who don't know about it, it is the Livestrong program is available at YMCA's across the country. And it's, if you have a YMCA near you, then give them a call and find out if they are running the Livestrong program. Any of them in this area offer, right?
Let me be a little clearer. You will find the information on the website if you type Livestrong, and then the process is somebody will, if you contact them, somebody will write back to you. You will have an interview actually with the lead trainer, and they will have you fill out some information about yourself and what you're struggling with so that you can actually safely join the program. And you will also need medical clearance from your doctor. And then we meet for the first time, and we'll just do some get to know each other games. It's already fun the first session, and then we will lightly engage in exercise, learn how to warm up, how to stretch safely, how to get intro into cardio, into different kinds of exercise. So the program is all about getting to know different kinds. I was a yoga lady, and I got to know functional movement, which functional movement is when you're in the gym and you're slinging the ropes around, you're smashing balls into walls. You will discover something that is fun for you because we're looking at everything.
Yeah. Yeah, I'm hearing the words like fun, community, learning, right? There's so much that you can gain from taking something on with others. And again, as you mentioned, the supervision. So that's really a wonderful aspect of the program. And the guidance and supervision, and then the accountability of the group and the fun, and it's sort of like
Yeah, very important. If you don't show up, people will ask where you were, and
yeah, that's fantastic.
They miss you.
Yeah. So tell me what you might say to someone who is considering getting started on with exercise. That you sort of said that it was hard in the beginning. What might you say, some words of encouragement to someone who's feeling that way right now, really wants to get started, but just that it's so hard to get started?
It's fun. It's free. You've got really nothing to lose, and you will feel a difference. And the first times you exercise will maybe feel hard and you will feel tired. But if you continue, I promise you, after 2 or 3 weeks, you will come out of there and feel a little bit energized. You will walk differently. And that is such an enjoyable feeling. You should really try it.
Just that feeling, that's wonderful. And just yeah, what would you say has been different at all about, if anything, different about your exercise now on the other side of your treatment than it was before? How you sort of cope with that or accepted that or changed as a result?
I think I'm more aware. I'm more careful. I used to always go over my thresholds and be hurt afterwards. So I'm way more in tune with my body and taking care of myself and not comparing myself to others. And I chose a really very, very slow and soft path to come back. I didn't force anything.
Love that. Yeah, really. That's really helpful. Thank you so much. And I think we'll turn now to Terry, but there may be questions that come back to you, Dorothy, so don't go anywhere. Thank you again. Oh, Terry, so welcome, welcome. We're so glad to have you as well. And I hoped you could speak to what motivated you around exercise, either to begin or to continue exercise, as you know, as some sort of sequence around your cancer diagnosis and treatment, and why you feel exercise matters.
Okay, so initially when I was diagnosed with my type of cancer in 2016, I had complications with 4 compressed fractures of my thoracic spine. So that really limited what I could do. I wasn't able to walk. I needed a walker at first, and then I advanced to a cane. But during this time, and not really sort of at that point understanding the benefits of exercise, how it can help, in cancer treatment, I was just trying to get better, trying to build my strength. And I set a goal of just slowly looking at what little accomplishments I was making. So I moved from the walker to the cane to then walking without assistance, setting goals of walking from my house to the mailbox, and then gradually increasing, my ability to walk to the point that then I was back to normal. So looking back, I didn't really realize that that was, in essence, a form of exercise. But now I realize, that it was, and then that really helped me in sort of seeing how far I came. It gave me a lot more confidence to keep going, to explore other types of, exercise. Um, I ended up participating in a Live Strong program about 2 years after my initial diagnosis. My oncologist had recommended it, and it definitely was very helpful at that point. I really was able to, follow along through the program and found it really helpful. Um, I think one of the things with me was that when I last year, I participated in a lifestyle medicine program. It was specific for multiple myeloma patients. And even though I had been, several years into the diagnosis, I was really happy to participate, learned a lot. And that's where then the real focus on the benefits of exercise really came in. And I think the point that really made the true connection was learning how exercise has such a positive effect on cancer patients, either those who are, post-treatment, or in my case, I'm always going to be on a treatment, but that it really helps. It helps build your immune system a bit. And so we all know that we're immune compromised. So when I heard that, I was like, this is something I can do. I can actively participate in ways to help me be better, aside from the medications and my, monthly clinic visit. So it just, I don't know, I learned that point, and I just felt a lot more empowered. And I have to say, since participating in that last year, the focus on different forms of exercise, how to incorporate it, little tips that I learned along the way have really been helpful. And also, not only with the 2 nurse practitioners who led the program, but then with the other 6 members of the group, we still continue to meet separate from the NGH. And we share, we learn. I'm still picking up pieces along the way. So it's just a really positive experience all along, and really grateful that, I was able to participate.
So I'm just thrilled that you're highlighting the wonderful work of Jill Burke and Dana Cameron, my colleagues in the Cancer
Right.
Center, nurse practitioner and practice nurse, and they work so hard to design and implement this lifestyle medicine program for multiple myeloma. And I've just heard such incredible things, so I'm so glad you're able to highlight your experience and just that group dynamic, the power of people coming together, sharing their experience and inspiring each other. It just sounds like that is like the special sauce, if you will, of the program. And I can see how for you it was so empowering. And I'm sure that your own story empowered the other people in the group. So that's just incredible. And thank you for highlighting their incredible work.
There's one other little point that might help for someone who maybe is at a very early stage of trying to introduce, exercise or physical activity. One of the points that I learned, it was called an exercise snack. And it's, if I have it right, it's considered 15 seconds to up to a minute. And it's basically different kinds of activities. So it could be walking up the stairs at a faster pace a few times, stretching. And what I liked about that was that's something that I could incorporate every day. And especially on a day that maybe I didn't feel like I wasn't felt great enough to go out and play pickleball, which I've been playing about 4 times a week, then at least I could do these little types of activities and still feel like I was getting some kind of benefit. And I liked that because it was at a lower end of the spectrum, but yet it still had a place and could be a starting point for someone.
Thank you so much for that extra point. Yeah, I have one other question. I hope you guys can hear me. I understand my audio is a little bit funky right now.
Yeah.
But I'll do my best. What other advice might you have? Again, like I asked Dorothy, for someone who's just not sure and is worried or maybe just isn't sure how to kind of take that next step. What might you say is one small step someone can take towards being more active?
I think for me, one was like the idea of the little exercise snacks as a way to just get going. If you're someone who's not sure and you think about, gee, I'm really sitting most of the day, I'm very sedentary, maybe setting a goal of every 30 minutes getting up and trying to do something like movement or stretching. I'll be in the kitchen cooking and I have a couple minutes between like when I next have to do a task for the meal, and I might just do a little bit of stretching, things that I would have never thought of doing before. But a lot of this came, especially after participating in the program. The other thing is starting out small, finding something that you like to do. And it could be very simple. And if you enjoy walking, maybe getting out and just try to be in the moment of being out, because it's easy. You don't need any equipment, and just try to appreciate nature. I know a lot of the members of my group all said that, they used to just walk, but now they walk more with sort of a peace of mind, and they really appreciate the nature part of it. And then that just has a little bit of a positive boost too. So starting out small, and also not feeling guilty if you set a goal and you didn't quite accomplish it.
Right.
It took me time and through the help of some of the members of my group to realize that it's okay, just accept it, and then you start. And I think it was mentioned earlier, then just, you can try again another day, but just start slowly, find something that you like, and also don't compare what you're doing to anyone else. You need to just be able to do what works for you.
Yeah, I like that so much, this idea of being true to yourself, being honest with yourself, and that even any given day might be different than another. So you just show up for yourself. Whatever is there is good enough. And that connection with nature and stress management and mindfulness, and compare those two pillars of lifestyle medicine together, right? When you exercise, being out there in nature. So thank you so much, Terry and Dorothy, for your inspiring words. And I think Sylvia had a comment, so I'll pass it over to her.
I just have to say, it's amazing to have your voices, Terry and Dorothy. Lauren and I do this all day, every day with patients, and we love to teach the PAVING curriculum. But it is really wonderful to hear people who are doing exercise in different way, who've gone through the sort of thought about lifestyle medicine in a more structured way, to talk about how it has been impactful. One thing that I love that Dorothy said was that the people in the room doing Livestrong were having fun. They were coming out laughing. Like, no doubt about it, any kind of a cancer journey is hard. It's anxiety provoking. There's pain and side effects, and you can just feel like your life is kind of thrown off the rails. And so to have a programmatic approach and the community of people who get it, you don't have to sort of explain why you might not feel energetic on a given day, or why you might be feeling anxious. There's just a common understanding. So I love that, that insight that you shared, Dorothy. And then Terry, like every cancer journey is different. You're describing having vertebral fractures, like the intense pain and lack of being able to do things. It's amazing to hear you talk about going from there and using a walker to, being able to be back doing normal activities and thinking about exercise, whether you're cooking and taking a break, or whether you're doing something like pickleball. Like I think that really speaks to the take small steps and know that you will get through today, and tomorrow will come and you'll get through tomorrow, and you'll maybe be able to do a little bit more tomorrow, and then you may have a terrible day the day after, but just kind of sticking with it. So I can't thank you enough for your voices and just the lived experience that you share.
Absolutely.
Thank you.
Yes. And just to highlight the lifestyle medicine program at the Mass General Cancer Center, I mean, we are really fortunate to have a wonderful team of multidisciplinary specialists that we see patient who've been treated at the Mass General Cancer Center. We're happy to welcome those folks for a lifestyle medicine consultation, a one-on-one visit where we meet with an expert in lifestyle medicine. And we also have a fantastic team of dietitians who can meet with folks for consultations. We have a fantastic group visit program actually just about to get launched over the next month. That's not the same exactly as the program for Terry did, but it's very much modeled similarly. That's for any diagnosis of cancer. And then we also have specific programs like the Paving the Path to Wellness program for breast cancer, the lifestyle medicine program for multiple myeloma that Terry and Dorothee had participated in. And then, of course, doing these webinars. So we really are trying to get the word out there and continuing to reach all patients in any way that we can through the series and beyond. So just a great time to talk about these things today. So do you have any last words, or are there any questions that I missed in the chat?
I think there was a question about exercise and the impact of exercising, a positive impact on nutrition. I think there is a positive impact, and I do think there's an interrelatedness. People have, both Terry and Dorothy have described like feeling better, which is both just feeling stronger and feeling good because you've gotten some physical activity, but also sort of the endorphins, the kind of just the mood improvement sometimes when you are physically active. So that's interrelated. And nutrition, if you're exercising, you will want to fuel those muscles best in order to build strength. So certainly someone who's doing more regular training is going to be mindful about the things that they're putting into their system that will help them get the most out of their exercise program. So I do think that there is an interrelatedness in lifestyle medicine. We think about that a lot, that all of these things, these topics that we talk about in this series are very much interrelated. In our next session, we talk about mindset and attitude. Again, that can be, there's nothing easy about what people are going through when they're going through a cancer journey. So how do you work on that mindset? How do you reset your attitude? And even if you've had a rotten day, know that the next day is coming and you can reset and sort of connect with strengths to kind of pull you out of a tough place. So that is what our next topic will be on Wednesday, November 12th.
Great.
Any other questions?
Yeah. I see Amy there again. And Dorothy, Terry, anything else you want to add? Not to pressure you.
When you see your friends and they want to take you out or give you a treat, just ask them to walk around the house with you as an additional little.
Yeah, that's great. Yeah, it's so much more fun, right? When you do anything, it's something like walking around the house. And, it's motivating. You said before, both of you said before, the power of others, right?
Yeah.
And then you're also, the other person is getting something out of it, right? Because we all need to move more. We all need to be less sedentary. So that's a win-win. Yeah.
There's a concept we love, which in addition to exercise snacks, which is habit stacking. Meaning, for example, if you have a meeting and you happen to be able to, nice day outside, you could either sit in a room and have your meeting, or if you're in the same building and could actually walk and have the meeting. So doing things where you're kind of stacking different activities and building in some exercise is another concept.
Yeah, I call it walk and talks with my
Yeah.
friend.
I love that.
Or when you brush your teeth, start balancing on one foot. I mean, don't kill yourself with a toothbrush, but play around. It's fun.
Yeah. And we would love, I mean, there's such a role for all of this, lifestyle medicine in any chronic disease. John mentions Crohn's, any of the cancers. At the moment, we offer it in certain disease areas, but it is very much applicable. So we hope that you can take any of these concepts and bring them back to your families or friends or other people you know who might be going through a cancer journey.
One more little plug. So on our lifestyle medicine program website, there is a library of previous webinars that we've done. And there are, I want to say, at least a couple that speak to exercise. One of them is specific to bone health in general, and it talks about specific exercises one can do to strengthen bone health. So please do check out our website for those resources, in addition to the Blum Center's library. So there's information out there, and we try to put it so that, again, you can access it for free and easily. So.
Thank you all, and a special thank you to Terry and Dorothy.
You're welcome.
I included all of the resources in the chat, including the link to the Lifestyle Medicine webpage, our next session. I also linked it to the Blum webpage that includes the entire schedule of the paving series. Visit back that page. It'll have the Zoom links closer to the date for you to attend them. All right, everyone. I think that is all that we have for today. Thank you so much, everyone.
All right.
Thank you, everyone.
Thank you, Amy and Dorothy and Terry and Sylvia.
You're more than welcome.
Hope everybody enjoys the day.
Yeah.
Take care.
Bye, everyone.
Bye-bye.